A silent, invisible internal killer has quietly replaced viral infections as the primary driver of mortality in modern India. For the last 4 decades, the country fought a massive, grinding medical war against infectious and communicable diseases, and they largely won. Aggressive public awareness campaigns mobilized communities block by block, actively halting the spread of historical threats like tuberculosis. Colossal investments in human capital and infrastructure built cutting-edge medical institutions and trained generations of world-class clinicians. This produced a formidable reactive system engineered to fix acute emergencies. Yet mastering the treatment of immediate infections left the nation completely blind to a slower-moving threat. Non-communicable diseases, heart attacks, strokes, cancer, and diabetes have steadily surpassed infectious diseases to become the leading causes of mortality. Right now, 270 million Indians are living with chronic diseases. The most alarming part of this massive statistic is the contradiction built directly into it. The vast majority of those 270 million people have absolutely no idea they are sick. A recent report from Apollo Hospitals outlines the problem clearly. As a society, we have entirely confused the reactive treatment of illness with the actual pursuit of health. A medical system designed strictly to repair broken bodies struggles to stop conditions that slowly damage organs from the inside over decades. Look at a human lifespan from 0 to 80. Biologically, there is a distinct critical window, the decade between ages 30 and 40. While individuals are busy building careers and supporting families, severe metabolic and cardiovascular risks begin to quietly take root. Because there are no physical symptoms, people in this demographic assume they are perfectly healthy. They avoid medical checkups entirely. This creates a delayed shock. By age 60, a massive proportion of the population is suddenly experiencing severe compounding health failures. By the time symptoms appear and a patient finally feels unwell enough to seek care, the primary opportunity for early, simple reversal has been lost. The biological fallout of this missed window carries severe economic consequences for the entire nation. Preventable illness actively diminishes the workforce, precisely during their most productive and capable years. The inevitable cascade of these chronic failures places a constant, unbearable strain on an already overwhelmed hospital system. The quiet loss of this vital young demographic undermines the nation's economic engine and its highest global ambitions. A young democracy cannot reach its global potential while its core citizens quietly lose ground to entirely preventable conditions. But there is a biological counterargument. The human body is highly resilient and capable of significant healing if intervention happens early. To reverse these trends during the critical window, the focus must shift to sustained monitoring, early detection, and routine lifestyle corrections. This requires adopting self-stewardship, an active, daily commitment to maintaining health, rather than simply reacting to sickness. This model directly challenges the old habit of living passively and expecting the medical establishment to fix problems after they occur. Health must be aggressively preserved at the grassroots level, within communities, long before patients ever reach an intensive care unit. Personal prevention is the most consequential duty a citizen carries, far outweighing any government program or hospital campaign. India already possesses the knowledge, doctors, and infrastructure. The final hurdle is for the population to adopt new daily habits. The stakes are absolute. The strength, vitality, and longevity of the entire nation rest squarely on the everyday health choices of its people. Stop passively waiting for illness to arrive, and instead take the active steps to protect your future, starting today. True health does not begin in a hospital. It is built entirely on the fearless choices made years before a doctor is ever needed.